my name is Kyle George, and I'm a rheumatology PA at St. Luke's Rheumatology in Idaho. Today, I've been asked to answer the question of what is the Inflation Reduction Act and how does it impact the affordability of biologic therapies for patients? The Inflation Reduction Act of 2022 is a landmark federal law aimed at reducing prescription drug costs for Medicare beneficiaries with significant implications for those taking expensive biologic medications. This law introduces several key reforms designed to improve affordability and access to care. One of the most impactful changes is that for the first time, Medicare now has the authority to negotiate prices for certain high-cost drugs. For biologic medications, price negotiations can begin 13 years after FDA approval, compared to 9 years for traditional small molecule medications. While this means newer biologics won't be affected immediately, it sets the stage for long-term savings on older, widely used biologics. Another major change is the introduction of a $2,000 annual cap on out-of-pocket spending for Medicare Part D beneficiaries, set to take place in 2025. This is especially important for patients who rely on biologics, as these medications often come with high cost-sharing burdens. This cap is expected to benefit over 1 million Medicare enrollees with substantial drug costs, offering them financial relief and more predictable expenses. The Act also includes a provision for inflationary rebates, requiring drug manufacturers to pay Medicare if they raise prices faster than the rate of inflation. This measure is designed to discourage unchecked price hikes across the board, including for biologics, helping to keep future costs more stable and manageable. In addition, the law aims to encourage competition through the use of biosimilars, which are lower-cost alternatives to the brand-name biologics. Once a biosimilar enters the market, any negotiated price reductions for the original brand drug are lifted. This shift is intended to make room for greater market competition, which could drive down prices even further for biologic therapies. Beyond these changes, the Act also limits Medicare Part D premium increases to no more than 6% per year through 2029 and expands eligibility for low-income subsidies, making drug coverage more accessible for our vulnerable populations. Overall, the Inflation Reduction Act of 2022 is expected to reduce out-of-pocket costs, slow drug price growth, and improve access to high-cost therapies like biologic medications. It marks a significant step forward in making the Medicare prescription drug program more affordable and equitable for millions of Americans. For more information on this and other topics, please visit wrap.org.